I think that to stay in your own home for a long time, as long as possible, is very important. Although I've seen with both of our parents, my mother-in-law and my mother, that there comes a time when you do need to be cared for, and that the perception of care homes is much better than some people think. There comes a time when it's a good idea to be cared for, but if your health is okay, then I think it's a good idea to stay in your own home as long as possible. I think to have some sort of mobility, to be able to get out and get contact with other human beings in the community, and I think that to be able to I think food is an important issue, because it just goes on and on every day, and you need to make sure that you're catered for, and the fact that you're warm enough in the winter and all that sort of thing. Family helps, but it's not always that you have close family nearby. And I'm one of those people. My daughter lives in Bristol, so she's quite a long way away.
In this part of Devon, we have a very high number of older people, and many of those people, as they move into the last sort of phase of their life, have become quite vulnerable. I had experience as a GP, but also I had been a carer for my father in the last years of his life, and so as commissioners we decided that it would be a useful thing to write some statements that reflected the outcomes that such a person might expect from their care in East Devon. The purpose of the statements was to represent what would happen to an individual person. So we wrote the statements, and we did so jointly with other health and social care staff and a variety of the other organisations that provide care. We then took the draft statements to a representative meeting where we had 65 people, ranging from older people themselves to counsellors to representatives of voluntary sector organisations and the various providers, and that enabled us to adjust the statements to make sure they reflected the views of a much more representative body. As commissioners, and we've agreed this with our partner providers, we're now intending to implement the statements as a way of monitoring what happens to the care of this group of people.
I'm Richard Mason. I'm a GP in Budleigh Salterton, and I'm really pleased that I've got David Bassett here with me, and he's one of the lay representatives on the Woodbury, Exmouth and Budleigh locality. And it was just an opportunity to describe some of the things that we've been talking about with regard to some of the options that are under review in the local community, where we feel some quite exciting plans that we've been trying to involve the community with about how we see the future of care and provision for our elderly.
I think one of the most important aspects or the developments in care in particular, and that social aspect comes into that, is obviously the care of people within their own homes. Elderly people in particular feel more comfortable, they're happier, they feel safer within their own homes being cared for, but that opens up a wider picture in terms of involving very much more of the community in that care programme.
One of the options particularly we've been talking about is trying to boost the voluntary sector involvement in the community hospitals, so that they become a bit more of a wellbeing centre for the elderly in particular. At the same time, having the reablement services in support of it, so that we would try to boost the day hospital, the physiotherapy, have our geriatrician specialists working from clinics there, with that idea of the patients being able to go in predominantly for that social aspect, the stimulus of meeting people and having a nice environment and being able to do things that they just can't do at home, and then at the same time have the opportunity to support them, as many will be living with long-term conditions and chronic disabilities. It was that idea of putting the care first, but also having that sort of bolt on, that support from the medical side. I think one of the catalysts that has allowed us to have these conversations more easily, and has certainly sort of driven some of these conversations, is the transforming community services.
I think what we've been describing in the last few minutes is just the start of probably complete transformation of community and other medical services that are provided for us as patients, as we enter, to some degree, a whole new world.
Christine Channon. I'm the Vice Chairman of Budley Health and Care Team. I'm also actually the County Councillor for the area. I think at this exciting point in changes, we're looking to see how we can marry together social care with health care, and really that's very important to me. We've had discussions at the Health and Care Team meeting, which is very representative of aspects of the community. I've also had 1 or 2 discussions with people on the Town Council. I've actually had some discussions at County Hall with people on the Health and Wellbeing Board. In fact, we will look at the whole person from not just as a patient from that point of view, from a health point of view, but from what is really needed in terms of health and social care in their lives.
I would prefer to stay in my own home for as long as possible, and if I can't be in there, I would like to go and stay with one of my daughters. I've got 3 daughters and a son, and I would like to live in some sort of annex or part of their house, so I could be with them but not living actually with them, kind of thing. And I assume my husband will join me. To be independent for as long as possible. I know quite a few 90-odd-year-olds who still manage to live on their own, who with a bit of help, and to me that's preferable than going into a home.
We know we're facing a huge challenge in the eastern locality. Our demographic of older people is way ahead of the rest of the country, and while that's great in many ways because we're keeping older people healthier, it also does throw up big challenges that we need to address. So what we need to do, particularly in these straitened times, is to be smarter in the way we put services together, and that means a much more coordinated approach, connecting services up together in a way that works for older people and their carers. So it means health, social care, the voluntary sector, the private sector, all working in harness together in a timely fashion to meet people's needs. And for us, and the voluntary sector as a whole, we know that we've got a key role to play in supporting older people, preventing ill health, combating loneliness and isolation, and also nipping problems in the bud when they appear, particularly for those people who don't have family and friends. And an example of that is we're right at this moment we're in discussions with the RD&E and the CCG about being part of a multidisciplinary team at the emergency department at the RD&E to avoid unnecessary hospital admissions by frail older people, by putting targeted interventions in that means they can safely be diverted from hospital back to home with a range of support that can much better meet their needs.
I'm Dr. Anthony Hemsley. I'm a geriatrician and a stroke physician, and for the last 3 years I've been the lead clinician for healthcare for older people at the Royal Devon and Exeter NHS Foundation Trust. From the acute provider perspective, what we're seeing is year on year rising tide of emergency admissions, and not least for older patients, and that's becoming unsustainable. And with the demographics as they stand and as they're going to change over the forthcoming years, we need to do something very different, very bold in terms of how we provide healthcare services. From my perspective, what we've done around that is to pursue some very challenging initiatives that have begun to break down the traditional barriers and the traditional models of how care is given. Another very important aspect of what we're trying to achieve is providing seamless care for patients, and really that means for organisations to work collaboratively and to stop working just within the four walls. What we would very much like to do is provide a geriatrician service, for example, that extends along the whole patient pathway, so from the acute provider out into the community and back. So actually there is continuity, the care is seamless, it's all joined up, and there's shared knowledge from community teams through to the acute provider.
Well, I think we'd both like to be cared for at home.
Yes, we have a home that's perhaps adaptable. So it's not as we have it at the moment, but we'd be looking for a carer, I think. Usually I've got cancer anyway, so I'm already under continuous treatment. I would wish probably for that to be as short as possible and to return home and to be looked after.
And I think, like a lot of people, I think we'd prefer to die at home.
Yes.
And just be taken away in a body bag. We're not into funerals.
The difficulty is older people are making an enormous impact on the NHS, and somehow or other one's just got to get that right.
Yeah.
So supporting the community, I think, could very well be that